Hi, I'm Harrison Saunders, CEO of Harrison Senior Living. Actually, the vast majority of our facilities are operating at a very high census level, and that's due to a number of factors. First, it's probably due to the known reputation that we have in those communities for being an excellent service provider with the best, most caring staff. Although most long-term care companies try to tout this feature, we do have some staff who have been with us for well over 30 years even in several of our locations. But one of the reasons we've been able to stay relatively full to the rest of the industry is the fact that we price ourselves at a rate that's affordable for most people, not just your top 5 or 10% wage earners in the country, but that anyone, a blue-collar family, might be able to have a place for their relatives to be without a great burden on the pocketbook. So we feel as though that gives us a competitive advantage. Recently, federal regulation has required long-term care providers to use electronic medical records. And we were actually an early adopter of an electronic medical record system called Point-Click Care. And we've installed computer kiosks throughout all of our facilities so that nurses don't go back to the nursing station to document care at the end of a shift. Instead, they document their work throughout the day to ensure it's more accurate, and the detail is there that may not otherwise be after such a long shift. So the early adoption of that technology has helped us to look at areas for improvement. It's helped us to understand our resident base, our population that we're serving, and their needs. And it helps us to tout our successes to our partners. Going forward in healthcare, it's going to be increasingly critical that long-term care providers partner with their referral sources, who are most often the hospitals. There are other referral sources out there, but the hospitals are the main referral provider. And what we found is that the presentation of our statistics to the hospital, touting our ability to provide a slightly better level of service and a quicker, more safe return to home without the risk of readmission to the hospital, is absolutely critical in our industry, and will become more so as they get penalized for readmissions. So we monitor those statistics closely. We go to the hospitals to speak with various levels of their management and leadership to ensure that they understand our position on the care that we're providing, and we give it attention from all levels in our organization. I'm at these meetings with great regularity to ensure that our relationship with our referring hospitals is absolutely secure.